Hello and welcome. My name is Garnet Gilmore. I'm the Director of Marketing and Sales for Warwick Forest, your premier sponsor for the Lifelong Learning Society. We are filming this morning from a beautiful one-bedroom apartment that we have available. This is the Birch apartment and this is the kitchen. As you notice, you have lots of room, lots of storage in the kitchen. We would love for you to come and visit us and take a tour. This morning, I'm going to be introducing Dr. Ney. Dr. Ney completed his medical degree and internal medicine residency at the University of Alberta in Canada. He completed a gastroenterology fellowship at the University of Calgary and an advanced fellowship in hepatology at King's College Hospital in London. Dr. Ney is currently board certified in internal medicine and gastroenterology by the Royal College of Physicians in Canada. Dr. Ney considers it a privilege to contribute to better health outcomes for his patients by treating gastrointestinal and liver disease. He has particular expertise and research experience in complex diseases in the liver. Dr. Ney not only considers the disease, but the patient who has the disease. Originally from Canada, Dr. Ney is fond of our area's weather, nature, and friendly people. He enjoys spending time with his wife and pets, in addition to water sports, recreational league sports, hiking, traveling, and reading.
Sorry.
All right, hello everyone. Sorry for a little bit of the delay there. Hopefully everyone can hear me all right. I'm just going to kind of adjust the camera a little bit here. All right. So thank you so much for joining me today. I'm going to be talking about the liver. And as the little preamble mentioned, I'm a liver specialist here at Riverside. So, and this is all about aging your liver with grace. This is not working.
Get it?
There we go. Okay, so I think you actually already got a little bit of an introduction to me. So I'm not going to spend a huge amount of time on this slide. But basically, I'm trained in both gastroenterology, so diseases of the gut, and hepatology, diseases of the liver. I did most of my training in Canada because I'm from Canada, and then spent a year as well in England at King's College Hospital doing advanced liver training. I have research interests in complications of cirrhosis of the liver, nutrition, and exercise as it pertains to the liver. Okay, so we're going to be moving on. And please let us know if there's any technical difficulties, you guys aren't hearing well, anything like that. And just, are questions going to come up through?
Yeah, I think they're going to come up through.
Okay, so I'll be able to see those. And or is there somewhere for you to be able to see them as well?
I'm seeing. I can't see them, but
okay.
On the other side they can.
Okay.
And either you can have them.
So there's chat over here.
Yeah.
Okay.
Okay. So yeah, they'll come up as questions.
Okay. So I think that this is where they would be over there. Okay, perfect. So I think if you guys ask questions, I'll be able to see over on the side of my screen. Please feel free to ask questions throughout the talk. We'll have a big section at the end of the talk to answer questions, of course. But if there's something that's confusing as I go, please feel free to ask. Okay, so before we talk about how to age the liver gracefully, we're going to talk about how not to age your liver gracefully. So this is actually a poem that my wife wrote. She's a poet, and she wrote a poem from the perspective of an angry liver. So I'm going to read this to you guys. So Hepatic Turmoil is the title. While you laugh and play and enjoy the finer things, it is I who works day in and day out to keep you vibrant, holding on to your 13% of your precious gore. Don't you understand? I may be small, but I am mighty. I break down and synthesize, fuel you with energy when your nutrients run low. Open up my store for you and clot your mistakes. But you are selfish, fraternize and indulge. Drink, gluttonize, and shoot up. While I usher your nonsense out, what doesn't kill you is going to scar me. Don't worry though, I'll regenerate, bounce back. Until you leave me with too many, like a battered housewife, you stupid, greedy dimwit. Don't you understand? Even if I look like one, you can't just toss me to the side like an old used-up football. Ventilators help lungs, dialysis for kidneys. But I am complex. I am special. Not my fault you never saw it. Now your only option is to replace me with a used-up doppelganger. Now you got me going. I've had enough. I'll fail you because you failed me. I'll shrink like all your cheap laundry, and never again will I justify the scars, because I loved the yellow narcissist responsible for my demise. So, an intense poem from an angry liver. But what we're going to do today is try to talk about how you can prevent this from happening and prevent getting angry poems from your own liver. This slide is supposed to actually be coming up piece by piece, but that's okay. I guess it's not working exactly correctly through the blackboard. But we've got some trivia about the liver to start off our talk today. Okay, so starting at the top left of the screen. The liver is actually the largest organ in the body aside from the skin. And it performs over 500 essential functions for everyday life. So you cannot live without your liver. An interesting thing about the liver is that it actually regenerates itself. So this is, of course, until the point where it can't anymore. So that's when the liver develops cirrhosis or end-stage scarring. But again, you can do some damage to your liver, and actually it can go back to a healthy state if you stop doing whatever that bad thing is to the liver. The liver actually filters 1.7 liters or quarts of blood every minute. So the entire blood volume is going through the liver within about a 5-minute span. So very, very, very interesting. And then the first successful liver transplant actually took place in the United States at the University of Pittsburgh in 1967. All right, so now that you guys are ready for your next pub trivia night, let's move on to the next slide. So this is an important slide, just going through the functions of the liver. So you can see in the photo there on the right of the screen, a liver. And the liver lies in the right upper quadrant of the abdomen and is, again, a vitally important organ. It's responsible for actually cleaning your blood. So all of the toxins that build up throughout the day from all of the normal functions of the body, or sometimes things that aren't supposed to have been have gotten into the blood, are all actually removed and cleansed by the liver. So it's responsible definitely for detoxifying your system. And that's why when people's livers fail, they can become confused, agitated, because they have chemicals getting into the brain that the liver is supposed to be removing. So the liver also regulates nutrients. So sugar, for instance, glucose, I think you've all heard of glucose. Glucose actually gets stored in the liver in the form of something called glycogen. So that's it's a bunch of glucose kind of packed together. And the liver actually stores that and can release it when required if the blood sugars are low. And when the blood sugars are high, it can kind of take more of that glucose back into the liver. The liver also helps with processing fats and proteins that you eat. In terms of proteins, the liver actually makes proteins too, and is vitally important in this function. Clotting proteins are all actually made in the liver, and that's why when people's livers stop to work, they can have problems with their blood clotting. It also makes immune cells, so immune proteins. So it's vital for immune function. Hormonal proteins are actually also made in the liver. So hormones are altered or also made in the liver. Cholesterol, something that a lot of people as they get older are trying to fight against, is actually processed, made, and dealt with through the liver. So sometimes people have genetic liver problems or metabolic problems where they actually have too much cholesterol, and that actually centers often around the liver. Vitamins and minerals are also processed through the liver. So that's another key feature. So iron and copper are two that are commonly processed throughout the liver. And then the production of bile. So bile is basically a way to help detoxify the body as well. So toxins are released through bile. It's then stored in the gallbladder, and then after a meal, the gallbladder will contract and release the bile into the small bowel, where it helps to digest fats. So we're going to move on to the next slide now. So I'm just seeing a couple of questions here. Let's just see. So Daryl asked, is it possible to cleanse the liver with herbs? And so I'm going to actually save that question for a little bit later in the talk, because I was expecting that question, and we have slides devoted to that coming up soon. And then Christine says, is this a slideshow? I have no sound. So I think there should be sound for Christine, but hopefully somebody with the technical side of things can help her out. So, sorry? It's her computer. Okay, perfect. So liver disease is not just something that affects those in the United States of America. It affects people all over the world. Of course, I'm from Canada. I also worked in England. There's lots of liver problems in those places too. It is actually one of the leading causes of death and morbidity throughout the world. So 2 million people every year worldwide from liver disease. And that actually is about almost 4% of the deaths across the world are from liver disease. So cirrhosis, which is again that end-stage scarring of the liver, is the 11th leading cause of death in the world, and liver cancer is the 16th. And liver cancer can come both from actually having cirrhosis of the liver, but also in places where hepatitis B is more prevalent. Hepatitis B is a major cause of liver cancer. All right, and it looks like someone's going to be helping out Christine, which is great. So I'm just going to move on. Oh, and shoot. So this, unfortunately, this slide was supposed to have about 10 pictures that I was going to show you, but it doesn't seem to be working. Do we know anything about that being able to be fixed so I can show the slide properly? It's not showing any of the actions.
See if Mackenzie can help with it.
So we're just going to give us a couple of seconds here for technical difficulties. She says she can fix it. Just one moment. Yeah, because all the actions that I made for the slides are not showing up. So this one, we're missing some fun photos. So we'll see if we can get it fixed. Any questions while we wait? So we'll give them just a couple of more seconds here, okay, to see if we can get this slide sorted out. We have another question about the liver cleanse. Okay, so we have a question from Cecilia, who's asking, can cholesterol medicine damage your liver? So that's a good question. We'll take a couple of seconds to talk about that while we wait to see if this slide can get sorted out. The most commonly used cholesterol medications are called statins. So things like Lipitor, Crestor, those sort of medications are called statins. And so those medications are clearly known to actually cause a little bit of an elevation of your liver enzymes. And so it is actually quite rare that the elevation in liver enzymes ends up being a problem where the liver gets sick from it. So a small elevation of liver enzymes is usually something that we can tolerate with a statin. There are rare instances where a patient can get acute liver injury or acute liver failure from a statin, and in those cases, the statin would need to be stopped. Overall, the research over the past kind of 10 to 15 years has shown that statins are actually generally helpful for the liver, so they can potentially help to decrease progression of cirrhosis and progression to liver cancer. So generally speaking, I don't specifically put people onto a statin when they have liver disease, but I definitely don't discourage them from taking a statin if they require it. So it looks like we've got the slide kind of coming up here now. It's a bit difficult for me to see on my screen. So we're just still working on it. So we've got one more question here from Harriet, who's asking, is there a blood test to determine if your liver's functioning is normal? Yes, there are blood tests that are very good to determine if your liver is functioning normally. So generally speaking, if you are going to be assessing your liver's function, the way that you would do that is by checking a few liver enzymes on the blood test. And then there's some certain types of tests called liver function tests, which are things that the liver does. So like making clotting factors and making bilirubin from bile. And so we check those blood tests, and if they're all normal, we usually assume that the liver is probably also normal. Rarely speaking, all of the blood tests could be normal, and there could be some damage that's been happening to the liver chronically over time. In those circumstances, an ultrasound or CT scan can show damage that's happened to the liver as well. So do you think is this kind of as good as we're going to get, or because now it's looking a bit too large and
Yeah. Hold on. Like, still.
and then we have another question from Harriet here about what is creatinine. So creatinine is actually something that's produced. It's a byproduct of muscle breakdown, and is something that we use because it's cleared through the kidneys. So that's a way that we use to measure kidney function. So is a kidney working well? So we don't use it as much in terms of determining if the liver is working well. And then Patricia's asking, how does your liver remove toxins? So that's actually a very, very complicated question. And if it was fully understood how that happened, we might be able to better, okay, it looks like we're back to the slide here, perfect. It looks like we might be able to actually better try to recreate the liver's function. But the important thing to remember is, unlike the lungs, we have artificial breathing tubes, the kidneys where you can have dialysis, a heart where you can have temporary pump to try to help pump the blood through the heart. The liver, there is no replacement that exists currently. So that's because the liver is so complicated and all of its functions are so complicated that it can't be simply replaced with a machine. So that question is a very good question, but I'm not going to be able to answer it for you in a kind of an easy fashion. Okay, so this slide is all about the many faces of liver disease. So when people think of a patient with cirrhosis and liver disease, they often think of somebody who looks like this. So somebody that's yellow, their belly is big with fluid, their muscles are wasting away, as you can see in the photo. But this is not the only way that somebody with liver disease can look. So let's see if I click, and is this going to work? I did that, or somebody else?
She's going to change it for you.
She's changing them for me. Okay. So this is a person who clearly drinks a little bit too much alcohol. So this is when somebody thinks of liver problems or cirrhosis, they usually think, oh, that person's an alcoholic. Now, while alcohol is definitely one of the top 3 causes of chronic liver disease in the United States, it is not the only cause of chronic liver disease. So it's important to realize that not everybody with liver disease is an alcoholic, although alcohol is certainly a significant contributor. So we're going to go to the next picture. All right. Now, obesity is also a major epidemic in the United States and is a huge contributing factor to the liver and basically to the development of cirrhosis. So that disease is called non-alcoholic fatty liver disease because it basically is not in people who have alcohol, but it creates fat in the liver. Too much fat in the rest of the body, diabetes, high blood pressure, that sort of thing, leads to fat getting into the liver and causing inflammation. So this is another very common cause of liver disease. But again, not everyone with liver disease is overweight. Next picture. So injection drug use. So this is a scary photo, but people who are known to inject drugs are at a very high risk for developing hepatitis C and hepatitis B, the viral infections of the liver. So while not everyone who has those infections actually acquired them via this route, this is another face of liver disease. And we have another question from Patricia. So she's asking, why is alcohol bad for the liver? So alcohol is actually what we call a hepatotoxin. So alcohol is processed through the liver. So that's where the alcohol is actually broken down, and it directly causes damage to the liver cells. So that's how it causes the damage. Now, a little bit of alcohol we'll talk about in a few slides in more detail can be okay, but much alcohol over many years causes long-term liver damage. So this is Jimi Hendrix. So Jimi Hendrix famously died of liver cirrhosis. So it's not just Joe Blow that gets liver disease. There's definitely famous people who have had liver disease. Next slide. Or sorry, next picture. And so for any of you who have ever watched Baywatch, you'll know Pamela Anderson. And she famously has or had hepatitis C, which is now cured. So certainly another celebrity with liver disease. And next picture. So it's not all just people who might look like they have something wrong with them. So this isn't a specific person. This is just a stock photo. But I see people like this in my clinic all the time. Young, healthy people who actually have liver disease. And somebody like this might be at an increased risk, for instance, for an autoimmune liver disease. So just to remember that there's many different things that can affect the liver. There's more rare conditions like metabolic conditions and autoimmune conditions, and then the more common conditions like we're going to talk about more in this talk. And then next picture. So hepatitis B is also very common in immigrant populations, specifically from Southeast Asia and Sub-Saharan Africa. So this is another potential face of liver disease. Although just because somebody is of Southeast Asian descent does not mean that they actually have a problem with their liver or hepatitis B. But certainly when you come from an endemic country, that increases your risk. So this can be another face of liver disease potentially, or faces. And next picture, please. And finally, the picture which you guys were looking at for so long before while we were trying to get things sorted, this might look something like you. So just to remember, you might be healthy or feel healthy, but it doesn't always mean that your liver is functioning well. The liver is a very resilient organ. So because it can keep replenishing itself and recovering, and you only need probably about 10 to 20% of your liver working properly for it to do all of the functions that it needs to do, sometimes people can actually feel well and have an underlying liver disease without knowing it. And that's why we're going to talk more about how to keep your liver healthy throughout this talk. And so we'll move on to the next slide now. All right, so this slide is about alcohol and alcoholic liver disease. So Betty White has a glass of wine there, and she's saying, but I only drink 1 glass of wine per day. But I hope that you all know that that's definitely more than 1 glass of wine. Even if you put it all in 1 cup, that's still a lot of alcohol. And so it's very important to talk about alcohol because that's one of the most common causes of liver disease, especially in the United States. Because in the United States, people like to drink. Now, if you've actually developed cirrhosis of the liver from any cause, you are not able to have any alcohol at all. Any amount of alcohol in that scenario can be very damaging to your liver because your liver at that point is not able to process the alcohol normally. So while if you have a normal liver and you had a glass of wine a day, your liver would be able to easily process that alcohol and detoxify it. The patient that has cirrhosis of the liver, they are having significant scarring in their liver, a decrease in function of the liver, and any amount of alcohol can severely damage the liver further beyond where it already is and risk progression of disease. Any patient that actually has been told that they have an alcohol problem or evidence of alcohol affecting their liver or causing liver damage needs to actually also remain abstinent for the remainder of their life to help prevent the progression of liver disease and allow the body at the time for the liver to actually heal itself. For people who have other liver diseases, I usually tell them that they should try to cut back as much as possible because, the less alcohol for the liver, the better. But I'm not going to hold it against them if, they want to have a drink at New Year's or have a drink, at the holidays or on a special occasion. For those of you that I hope are healthy at home, the amount of alcohol that's recommended to be safe in a week for men is 14 per week, so 14 drinks per week. And I wrote there not all at once because we're not going to suggest that you should binge drink, but a small amount of alcohol each day can be safe. Women, because women are smaller and they don't process alcohol quite as efficiently as men for the most part, the recommendation is for 9 per week. All right, and again, not all at once. So we'll move on to the next slide. So this slide basically is showing what one drink is. Because again, just like Betty White, some people are confused about what a drink is. Because some patients will come to see me in clinic and say, oh, I only have 1 drink a day. And I say, well, what's your drink? And it's like, well, it's a full glass of scotch. And so a full glass of scotch is probably more like 5 or 6 drinks. So it's very important to understand what a drink is. So a drink is a 5-ounce glass of wine, a 1.5-ounce glass of hard spirits, and a 12-ounce bottle or can or glass of beer. Okay? So those are what we mean when we say one drink. All right, next slide. All right, so next we're going to talk about hepatitis C. So hepatitis C has been in the media and the news lots over the past 5 to 10 years because over that time period, hepatitis C has gone from being a very difficult virus to treat with a lot of difficulties with the treatment, people feeling very, very sick or even dying from the treatment for hepatitis C, to a point now where we can cure almost everybody that has hepatitis C with a simple pill or a series of pills for a short amount of time, between 8 and 12 weeks. So the field of hepatitis C has been revolutionized over the past 10 years. So that is partly why the U.S. Preventative Services Task Force actually recommends that all adults, so between the ages of 18 and 80, all adults should receive a screen for hepatitis C to see if they've been infected previously or are actively infected. Now, this is, of course, for people who haven't already been screened. But the thing to remember about hepatitis C is that by getting the virus or acquiring the virus, you do not develop immunity to the virus. So just because you've been infected before does not mean you cannot be infected again. So that means that you need to try to avoid the risk factors for hepatitis C. And so I'm going to go through those now. And if any of these things sound like you, while I'm saying that everyone should get screened if they haven't been before, you definitely need to be screened if you have one of these risk factors. So people who are actively injecting drugs or who have injected drugs previously in even 40 years ago can be at risk for development of hepatitis C, because hepatitis C is passed through the transmission of blood-borne and, to a lesser extent, sexual products. Intranasal cocaine, or sometimes crack cocaine use, is also a risk factor for hepatitis C. Aside from drugs, tattoos are actually a risk factor. Now, generally speaking, if you've had a tattoo at a reputable parlor that cleans its equipment, that is not a risk. But anybody who's ever had a tattoo done by one of their friends, especially if they've been incarcerated and have prison tattoos, those are extremely high risk for development of hepatitis C. and I see a number of patients that have acquired their hepatitis C from those means. That also includes people who have gotten their tattoos done in developing countries, that sort of thing. Now, unfortunately, it's a bit of an unfortunate kind of dark cloud on the blood transfusion industry, if you want to call it. But prior to 1992, the blood products were not actually universally screened for hepatitis C. Now, this is partially because hepatitis C wasn't, they didn't know what hepatitis C was leading up to that time, but there certainly was a time period where there was a lapse between knowing about hepatitis C existing and actually testing for it in the blood. So unfortunately, people who have had blood transfusions prior to 1992, they are actually at risk for hepatitis C as well. And the more blood transfusions you've had prior to that, the higher the risk might be for having caught hepatitis C by that means. Now, finally, I've put there high-risk sexual behavior, and especially men who have sex with men are at higher risk for hepatitis C. Now, generally speaking, the risk of hepatitis C from sexual transmission is relatively low in heterosexual couples. The quoted rate for a monogamous married heterosexual couple is about a 1% per year from one partner that's positive for hepatitis C and the other partner that's negative for the other partner to turn positive or to become infected. So it is a low risk, but it certainly is a risk that is there. So just to as a reminder, there is a cure available for hepatitis C. So it's very important when you get screened, if you come back positive, that's why you come and see me, and we get you treated and cured. And as I mentioned, there's always a risk of becoming reinfected if you're up to naughty behavior. So next slide, please. All right, so now hepatitis B. So hepatitis B is not as common of a disease in the US, or especially in this area, as it would be in some other parts of the world. And most of the patients that I actually see with hepatitis B are either from an endemic country or region, or have family members that are from an endemic country or region. So quickly, before we go on to hepatitis B, we have a question from Patricia McClelland about the cost of hepatitis C pills. So she's asking if the cost of the hepatitis C treatment is still very high, and it certainly is. That is certainly true. But with that being said, generally speaking, there really should be no scenario where you would have to pay any significant amount of money out of pocket for treatment for hepatitis C. So all types of insurance will cover the treatment of hepatitis C, and for those individuals that are actually uninsured for whatever reason and are unable to afford insurance or unable to afford hepatitis C treatment, there are actually treatment programs through some of the drug companies to help get treatment for hepatitis C. So there really should be no reason in general, as long as a patient is keen, compliant, and actually follows the instructions from the doctor, that they should not be able to be treated for hepatitis C for a minimal cost. So moving on about hepatitis B. Again, we don't have as much hepatitis B in this area, but we will go through some of the risk factors for development of hepatitis B. So again, if you come from an endemic region, so those are Southeast Asia, Central Asia, the Mediterranean Basin, Eastern Europe, Sub-Saharan Africa, the Middle East, or certain parts of Latin and South America, you are at potentially higher risk, especially from Southeast Asia and Sub-Saharan Africa. Now, the primary way by which hepatitis B is actually transmitted and where a chronic infection actually develops is usually at birth or in the first couple of years of a child's life. And they usually acquire the virus either from medical equipment in a situation where medical supplies are not cleaned appropriately, or most commonly from mother at birth or from mother or father in their first couple of years of life, because those mother or father are actually infected with the virus themselves. So that is why vaccination for hepatitis B universally is vitally important to help prevent the spread of this disease that affects so many people globally and causes such a large burden of disease. So anybody from those countries that is living now in the US and has not been tested for hepatitis B really should be considered to be checked. And actually, if your parents are from those countries, it is actually reasonable to also be checked and screened for hepatitis B. We have another question. So the question is jaundice a form of hepatitis B? So jaundice basically means that your skin and often your eyes will turn yellow. And that happens from a certain chemical in the blood called bilirubin being elevated. So there are many reasons why bilirubin can become elevated, but one of the main reasons is because of liver disease. So while hepatitis B can certainly cause jaundice if it causes significant liver disease, either in an acute form, so suddenly attacking the liver, or chronically over many years attacking the liver and causing damage over time, jaundice can be hepatitis B, but many other things, including liver diseases and non-liver diseases, can also cause jaundice. But if you are experiencing jaundice, you absolutely need to go to a liver doctor or at minimum see your primary care provider. So moving on, other risk factors for hepatitis B. So if there's a family or household history of hepatitis B, so anybody living in your house, like a partner or a sexual partner that has hepatitis B, that would be important to be assessed. And because hepatitis B is such a high risk for developing liver cancer, if you have a family history of somebody having liver cancer, especially again if they're from one of these other countries, that is something to kind of cue you into the fact that maybe that person actually had hepatitis B, and you might need to be checked as well. Again, if there's a history of injection drug use, that's a risk factor. Men who have sex with men, again, a risk factor. High-risk sexual behaviors, so that's including people that are in sex work or very promiscuous. Those can be risk factors as well. And again, as I mentioned before, if you have somebody that you know of that you've had intercourse with that has hepatitis B, that's a risk factor. And anybody who has a history of HIV or hepatitis C, those viruses kind of all run together. So it's important when screening for one of those things to screen for all of those things. So next slide. So the last of the main three hepatitis viruses is hepatitis A. So that does not actually cause a chronic infection of the liver, but can cause an acute liver injury. So that's not something that you want because you can actually have liver failure from a case of hepatitis A on a rare occasion. So it's actually important to try to avoid hepatitis A the best that you can. So hepatitis A, unlike hepatitis B and C, is transmitted by what we call the fecal-oral route. So that means that basically fecal meaning poop and oral meaning mouth. So virus that's getting shed into someone's poop is getting in your mouth somehow, which no one likes to really think about that. But that often happens in places where the conditions are not very good. So often in developing countries where food products may not be cleaned properly, hand hygiene might not be appropriate. Even ice cubes can sometimes be infected in some of these sorts of places. So it's very important if you're traveling to the developing world to actually be vaccinated for hepatitis A prior to your trip. As well, in terms of local risk factors, or domestic risk factors, work in a daycare setting or having a child in daycare is also a risk factor, and that's just because kids transmit illnesses like nothing else, and if there's lots of kids in an area, there's always a risk that if one is to develop hepatitis A, that can be passed quite significantly throughout the entire daycare facility and then passed to parents and other sorts of people. Again, men who have sex with men are at higher risk for development of hepatitis A, and being homeless is another risk factor. So we can move on to the next slide. So again, it's important to make sure that you're vaccinated, as I just mentioned, and there is a vaccine called Twinrix, and that vaccine actually is called Twinrix, twin like two, because it vaccinates for both hepatitis A and hepatitis B. So while people now going through school in the US are vaccinated for hepatitis B, many people that might be watching this talk may not have been vaccinated for hepatitis B as they went through their schooling, because that's not something that really came into play until a number of years ago. So there is a recommendation generally for universal vaccination for hepatitis B. So especially if you have liver disease, but even if you don't, it can be reasonable to be assessed for hepatitis B and to be vaccinated if you're not immune. And then again, for hepatitis A, if you're going to an at-risk situation, it's very important to be vaccinated beforehand. And we can move on to the next slide, please. So this is a little disclaimer, but you have to remember that age does not protect against sexually transmitted infections. So some of these viruses, as I mentioned, there are a risk of developing them through sexual contact. And there's of course other infections that can be sexually transmitted as well. So it's important to use condoms if you are sexually active and not in a monogamous relationship. So just something to always remember, which sometimes is forgotten after the risk of child or becoming pregnant or childbirth is out of the equation. Next slide, please. So next we're going to talk about non-alcoholic fatty liver disease. This is also called NASH, or non-alcoholic steatohepatitis, or metabolic associated liver disease. Now this is the liver disease that is increasing the most rapidly in terms of prevalence in the United States of America and around the world. And this is due to the obesity epidemic. Okay, now you don't need to look like this muscle man in order to avoid NAFLD, or non-alcoholic fatty liver disease, but you do need to lead a healthy lifestyle, okay? Especially if you've been told that you have fatty liver, or that's usually from an ultrasound test. It is very important to actually really make sure that you're leading a healthy lifestyle. The main two reasons why people have fat in their liver are from alcohol use and from obesity, diabetes, high blood pressure, high cholesterol, those sort of things. Okay?
We've got a question.
We've got a question. Okay. Can you speak about increased echo texture with a lifetime history of normal liver function tests, no increased iron stores, normal abdomen, CT, and no history of alcohol abuse? And can it be safely ignored? That's a question from Linda. So I'm having a sense from Linda that she's either read this off of her own ultrasound report or off of a close family member. So increased echo texture is often related to fat that can be in the liver, although not always. I generally would have to actually see the ultrasound or the ultrasound report to comment fully about that. But usually if the liver enzymes are completely normal and there's no major risk factors, if there's mild fatty liver, usually we just recommend for people to try to work on some of the type of stuff that I'm going to talk about. But that is certainly the type of thing that could be reasonable to see me in clinic about, or another liver specialist. There's testing we can do to kind of look and see if there's been any stiffness which has developed in the liver. A test called a fibroscan that can be useful to help make sure that we're not missing anything in that scenario. Okay, so how do you manage non-alcoholic fatty liver disease, or ideally prevent it from even happening? So a Mediterranean diet has actually been studied to assist in people with fatty liver, but Mediterranean diet is not the only type of diet that you can use. Generally, a healthy diet is what's important. We'll talk a bit more about that on the next slide. But Mediterranean diet is generally a healthy style diet. Vegetables, fruits, olive oil, lean proteins like a lot of seafood and chicken, and lower on the processed carbs. So that's generally a healthy style diet to take. Now you'll see there about a BMI. So you want to try to be a healthy weight. So a BMI between 18.5 and 25. It's very important to actually perform cardiovascular and resistance exercise 30 minutes per day, 5 days per week at least. So very, very important to be staying active. So again, that's with something cardiovascular. So like going on a bike, or going for a walk, or going for a run or a jog, or going for a swim, or going on one of those machines at the gym. And resistance exercise being something that works your muscles a little bit. So lifting light weights, pulling on resistance bands, that sort of stuff. And then I wrote there, vegetables are your friend. So that's definitely true. Vegetables are the best way to try to prevent obesity and to promote a healthy lifestyle and a healthy body. Okay, so next slide, please. Excuse me. So we can move on to the next slide. Thank you. So here's just some general healthy eating tips. And this applies to everyone, not just people with liver disease. So vegetables and fruits should be the kind of major component of any good diet, because that's what helps to keep you full, and they're healthy, filled with nutrients and fiber. A high fiber diet, of course, is important, and high fiber whole grains are another good way to get lots of fiber. Now, it's important not to have a diet that's super high in carbohydrates, but of course, you're going to have some carbohydrates in your diet, and in those situations, brown breads, brown rices, that sort of stuff are a lot healthier, things that have more fiber. Lean proteins, so like fish, seafood, and skinless poultry are important. If you're going to have dairy, low-fat dairy or no-fat dairy is generally the way to go, trying to avoid the high-fat butters and creams. Avoiding trans fat is very important. So trans fat is you don't want to get any of that in your diet if you can avoid it. That's a kind of a processed type of fat, or hydrogenated vegetable oils. Those are known to increase cholesterol, increase risk of cardiovascular disease. So definitely something you want to avoid. There was actually a study in the biggest journal in medicine called the New England Journal of Medicine that talked about how people who took a small amount of olive oil and/or a small amount of nuts in their diet actually decreased their risk of cardiovascular disease. So I like to recommend to my patients with fatty liver, especially because they are at increased risk for developing heart attacks and strokes, that they should take a small amount of olive oil in their diet. Generally, use that for cooking and potentially in your salad, and a small amount of nuts. So that doesn't mean eating a whole big thing of nuts every day, because that will be unhealthy with too much fat. But a small amount of nuts with those healthy fats can be good for you. You want to try to avoid added salt and hidden salt. So remembering that most of the type of stuff stuff that you would have at the grocery store that's coming in a can or in the frozen section or in a bag that's processed is going to be high risk for developing high risk for developing too much salt or having too much salt in the diet. As well, adding salt, of course, is something you want to avoid. So it's good to try to get in the habit of reading the labels of the things you buy at the store, making sure that they don't have too much salt, that they don't have a lot of trans fat in them, and that they're often high in fiber. And then finally, drinking lots of water. Water is going to really be the main thing you want to be drinking, along with coffee and tea. You want to be avoiding those sugar drinks. Those are just endless calories. Very, very bad for you. And even the sugar-free drinks, studies have basically shown that people that drink sugar-free drinks are at just as high a risk of being obese or overweight as those who drink sugar-containing drinks. So it does not help with weight loss, and the chemicals in there are not healthy. And to be perfectly honest, a lot of those sugar-free chemicals can go into your gut, be processed by the bacteria in your gut, and be reabsorbed back into the body as a kind of nutrient or sugar or fat, and can cause problems because of that. So we have a question from Tahani here about what about baby aspirin? Generally speaking, the medical community goes back and forth about baby aspirin. Baby aspirin is definitely helpful for those that have a risk or often family history or personal history of strokes and heart attacks. So it's certainly important to talk to your primary care provider about whether or not you would be a good candidate to be on aspirin. Generally speaking, we don't recommend people to be on aspirin just because as a kind of what we call primary prophylaxis, or just to try to prevent that from happening, unless they're at specifically higher risk. And we don't specifically recommend for people to be on aspirin for anything to do with their liver at this point in time. And then we have a question here: are drinks with stevia okay? From Paul. So stevia is a kind of natural artificial sweetener that is kind of touted to be healthy, generally speaking. What I generally recommend, obviously, generally speaking, if the less processed and the more natural a sugar product would be, probably going to be more healthy, the less processed it would be, but it's still sugar. And it's still the type of thing that can be processed through the body. So I think probably it's healthier than taking an artificial sweetener, but is it better than just having water alone? Probably not. Okay, next slide, please. Okay, so as promised, we're going to talk about liver cleanses now. So liver cleanses are not a thing. So that's the key thing I want to get away from this slide. Liver cleanses are advertised, touted in the media, touted from naturopaths and other sorts of pseudoscientists. And the problem is that when you put something into your body that hasn't been studied and hasn't been extensively looked into by scientists and medical professionals, you're putting yourself at risk. While many of these products may be safe, we would really have no way of knowing that without them being studied. So in the same way that you wouldn't take a medication that a drug company made and just take it without it ever being studied in trials and with people being tested previously, you shouldn't do that with natural substances either. There's actually been proven evidence of liver failure from some of these substances, and that's the opposite of course, what they're touting to do. So while it, of course, is possible that there is some substance that could help your liver, that substance has not yet been discovered and has not yet been tested in human trials. This specific product, the Himalaya liver care product, actually was recorded in the literature to cause an episode of liver failure in a patient. So I wrote here, the liver does not need to be micromanaged. And in general, treat your liver nicely, treat your liver with respect, do all the type of stuff that we're talking about in this talk, and you're not going to need to have a liver cleanse. And then the question here, would you say that drinking lots of water is a sort of liver cleanse? So I wouldn't say necessarily, and that's from Sylvia. And so I wouldn't say necessarily that that's a liver cleanse per se, but I think drinking lots of water is definitely very healthy, is good for especially your kidneys, but lots of your other organs, including your liver. And so I think drinking lots of water, unless there's a specific reason why you can't have too much fluid from another medical condition, is a good idea. And we can move on to the next slide now, please. So this is kind of going on from what we were just talking about, but you need to be aware of herbal substances. So people have this sense that because something is natural, that it's safe. And I've just got a few things on the side of the slide here that kind of prove that to be incorrect. So the top left there is a picture of a mushroom. And so while I love to eat mushrooms, I don't like to eat these mushrooms because this is the death cap mushroom, Amanita phalloides. And so the death cap mushroom is a no cause of liver failure. So that's a natural substance that causes your liver to fail. And people die from that when they eat it if they don't get a liver transplantation. The next picture over in the green there is tobacco. So tobacco is a natural substance that's grown, and I don't think anyone would think that that's very healthy to take. And that is a cause of huge morbidity and mortality throughout the world. And then you can see there arsenic. Arsenic is a natural substance, and I wouldn't really recommend taking that. So just because something's natural doesn't mean it's not good either, though. There can be natural substances which can be very helpful for the body, but they need to be studied, and they need to be researched and need to be monitored. And the problem with some natural substances, or many natural substances, is that they are not put through the same rigorous testing by the FDA as medicinal products. So you'll read on the bottle somewhere that the medicinal claims are kind of not substantiated, and that they can't claim to be medical products because they haven't been tested. So I see frequent cases of people who develop liver injuries, liver failure, and even death from taking natural substances for all sorts of reasons. Sometimes it's for their liver, sometimes it's for this, sometimes it's for that. Some natural substances are safe and have been shown to not cause a problem for liver disease, but can cause other problems. But generally speaking, if you're ever going to be taking a natural substance, it would be very important to talk about that with your doctor first, and realizing that nothing's free in life. So if you take something, the chance that there's going to be a benefit from it and no risk of a side effect is unlikely. Okay, next slide, please. So Tylenol. Tylenol is safe. You wouldn't believe the number of people I see in my clinic who are told by their doctor that they can't take Tylenol because it's bad for the liver. And that includes people that actually have liver disease or cirrhosis. So Tylenol is actually one of the safest medications known to man. It very rarely causes any problems if taken in the recommended dose. People who overdose on Tylenol, often as an intentional suicide attempt, those people can develop liver failure and death. People who take Tylenol within the recommended daily amount, so less than 4 grams a day for the average healthy person and less than 2 grams a day for somebody who has liver disease, will have no problems with their liver because of Tylenol. And it's actually the safest painkiller that you can take for your liver. You only really need to avoid Tylenol if you're in acute liver failure, and if you're in acute liver failure, you should really be in a hospital, and they can be helping you to manage your medications. Tylenol is a much safer option than what we have on the next slide, which we can now go to, which are non-steroidal anti-inflammatory drugs, or NSAIDs. These drugs keep me basically in business as a gastroenterologist because I see people so frequently that have ulcers in their stomachs and small bowels bleeding from these sort of medications. As well, these medications can cause serious damage to your kidneys. Now, people that have liver disease are at increased risk for development of both ulcers and kidney disease. So it's vitally important that people with liver disease stay entirely away from all of these sorts of products. And if you don't have liver disease, my recommendation would be use Tylenol first, and if you got to use these things, try to use them in small amounts. All right, on to the next slide. All right, so finally, I have some good news for you guys. Instead of telling you everything you can't do, finally, I'm telling you something you can and should do, which is to drink coffee. So coffee is extremely healthy for the liver and has been studied frequently in terms of many other health conditions, and never has really been shown to actually cause negative health effects. Now, I mean, if you suffer with anxiety and coffee causes you to have anxiety, maybe it's not a good choice for you. Or if you suffer with diarrhea and coffee makes you have a lot more bowel movements, maybe it's not a good idea for you. But generally speaking, coffee is very healthy for the liver. It's been shown to decrease the risk of progression of alcoholic liver disease. It's been shown to decrease the risk of progression of cirrhosis, and also to help halt the progression of liver cancer, or to prevent liver cancer altogether. So coffee is good for you. We can move on to the next slide. So this is going to be our summary slide now. So overall, you're going to hear a lot of things in summary, which are the same sort of things I'm sure you hear from your primary care provider when you see them in clinic. Eat healthy, please. Take care of your body. Exercise. Again, take care of your body. Do the sort of stuff that we were talking about in the talk. A maximum of 14 drinks per week for men and 9 drinks per week per women is safe for people that don't have liver disease. You should get screened for hepatitis C if you haven't been screened for hepatitis C before. You should get screened for hepatitis B if you have any of the risk factors that we talked about earlier in the talk. And of course, consider getting vaccinated if for hepatitis A and hepatitis B if those criteria fit you. Liver cleanses don't exist, at least not currently, and please don't try to take them. Never take untested substances and put them into your body, because you just don't know what's going to happen when you do. And drink lots of coffee. So let's move on to the last slide here, which is whether or not we have any more questions. Okay, so Patricia's asking if I'm going to talk about liver partial or complete transplants. So I didn't put anything into my talk today about liver transplants. Liver transplants are generally reserved for people who obviously have either acute failure of their liver due to kind of one of the things we talked about today, or other things that are less common that we didn't talk about today, or who have developed chronic liver disease or cirrhosis of the liver. Now, generally speaking, those people would be assessed by a liver transplant center. So our associated liver transplant center with Riverside is VCU. So often somebody who had liver disease would see me in clinic, and if I thought that they needed to have a liver transplantation because their liver was too far gone or too sick, I would potentially send them to the VCU liver team to be assessed for liver transplantation. And that's actually a way to, save somebody's life that has significant liver disease if they're a good candidate. And there are, as mentioned, partial liver transplants. So you would actually get a half liver from a healthy donor. The donor's liver then over time would grow back to almost its previous size, and the new liver, which was a half, over time would grow to the previous size. Now we got more questions.
Okay.
Sorry?
I think I had a slide on there with your office
Yeah,
information.
is that not on there?
Yeah, let me see if she is. There.
Oh yeah, there it is. Okay, so we're just gonna put up my office. Oh, they're gonna get that back. We're just gonna put up my office information if anybody needs to make an appointment with me for any liver issues or GI issues. Always happy to see you. And let's go back to the questions here. Are liver cysts something to be concerned about? So that's a good question, Melanie. So generally speaking, no, but it depends is the answer. So generally speaking, if it's actually a true liver cyst and the imaging says that it's a cyst, that's unlikely to be anything that's going to cause you any sort of problems, unless you have a condition called polycystic kidney disease, in which there are a lot of cysts which develop in both the kidneys and the liver. In those circumstances, if the liver gets filled with cysts, then sometimes the liver doesn't work properly anymore, and somebody may need to have a liver transplant for that purpose. But that is extremely rare. So if it actually says specifically that it's a cyst in the liver, usually that's not something that you need to worry about at all. And then the next question is, will liver enzyme levels change, go up and down with NAFLD? So remembering NAFLD is non-alcoholic fatty liver disease. So liver enzyme levels are not always predictable in somebody that has non-alcoholic fatty liver disease. So generally speaking, if there's some level of inflammation going on in the liver from the non-alcoholic fatty liver disease, the liver enzymes are often a little bit elevated. They don't usually go more than 1 or 2 times the upper limit of normal in terms of that test when it comes to the non-alcoholic fatty liver disease. And it's not always a good test necessarily to actually monitor how the liver is doing when it comes to non-alcoholic fatty liver disease. While certainly the liver enzymes being elevated might alert a physician or alert the patient that there's actually a problem with the liver, following the liver enzymes isn't always going to be the most beneficial thing. Excuse me. So we would follow things like liver function if the liver's gotten sick enough where actually the liver's not starting to work anymore. We can follow those. We can follow along with a FibroScan, like I talked about before, to help to try to quantify the scarring in the liver. And if you have the right type of FibroScan machine, you can actually quantify the amount of fat in the liver and follow it that way. And then we would follow a patient clinically. And then otherwise, sometimes we need to use tests like MRIs or liver biopsies to follow the amount of scarring and damage that's happening in the liver from non-alcoholic fatty liver disease. So I'm not seeing any other questions at this time. So there's a thank you. Thank you, I appreciate that. And then we have another question here. Is a liver biopsy common? So liver biopsies, I guess it depends for who. If you're asking is liver biopsies common for me, yes, because I see liver disease, and so I do organize liver biopsies for some of my patients. I try my best to avoid doing liver biopsies for patients because liver biopsies do have a risk. Although it's small, there is a risk with liver biopsies. So if I can gather the information that I require from blood tests and my clinical assessment of the patient, that's my preference. But for certain people where we either can't figure out what's going on or we know what's going on but need information from the actual tissue from the liver, then we would need to do a liver biopsy for those patients. And there's 3 different ways that you can do a liver biopsy. One is what we call the percutaneous method, which basically means they stick a needle through the skin with some local freezing into the liver with an ultrasound guidance. The second is what we call the transjugular method. So they actually put a long catheter through a vein in your neck, the jugular vein, and they put that all the way down towards the liver, and they take a sample that way. And then Third, there's a newer way that we can do it, which is actually via an endoscopy, so putting a camera into the stomach and using an ultrasound probe on the end of the camera to go through the stomach into the liver and take samples that way. Let's see, we have any other questions? No, I think that's all the questions we have there, and I appreciate all of the thanks. I'm of course happy to do it, and
Yeah, I think that's it.
I think that's it. So I'll look forward to either seeing some of you guys in clinic or in the community over the coming years. Okay. So